Good afternoon, ladies and gentlemen, and welcome to your program You and Health, aired on Quinoxe Radio Multimedia. For presentation, I am Monsieur Lucy Liengu. It is a disease that is a significant global health concern affecting millions of people worldwide, including Cameroon. This viral infection primarily targets the liver, leading to serious health complications such as chronic liver disease and others. Sure, you must have guessed the disease already. We are talking about hepatitis B. Today we'll be talking about the causes and also the treatment options available for hepatitis B with a generalist or a Tradi medical practitioner. And before I introduce our guest for the day, my co-host is Immaculate Foge. Good afternoon, Ma.
Good afternoon to you, Lucy. Good afternoon to you, Doctor. And good afternoon to our millions of televiewers and listeners of Quinoxe Radio and, of course, television.
Thank you. It's always a pleasure having you.
The pleasure is shared.
And our guest for the day is Dr. MUVALA Marcel. He is a Tradi medical practitioner. Good afternoon, Doctor.
Good afternoon, Madam. I want to say that I'm very happy to be part of the program here this afternoon. We'll be talking hepatitis B, the possible causes, and then the risk factors, and then possibly the treatment too.
Thank you. Having you on the program today is a pleasure.
Thank you.
And now, straight away, without any waste of time, we would like to know, Doctor, what is hepatitis B all about, and how is it transmitted?
Okay, hepatitis, as the name starts, when we talk about hepatitis, we mean a situation that is affecting the liver. So once the liver is inflamed, we say that the patient is having hepatitis. So the hepatitis B virus, the B virus is one of the viruses that actually affect the liver and causes liver inflammation. That is where the name hepatitis B came from. But one thing I would like to make our listener to understand is that it's not only the hepatitis B that affect the liver. Hepatitis B is just one of the 5 viruses that have a serious effect on the liver. We have hepatitis A too, we have hepatitis C, we have D, and we have hepatitis E. But hepatitis B is the most common and the most widely spread viral infections that affect the liver. So it is one of the viruses that is easily transmitted from one person to the other. I think it is a virus that we really need to look into it, because many people are suffering from it unknowingly, and those who have the infection, they don't know the preventive measures to take, maybe to protect their partners or protect themselves from other complications that can come as a result of that infection.
And now you just made mention of transmission. How is it transmitted?
Okay, because the hepatitis B virus is found in the blood. It is found in the semen. It is found in body secretion like the saliva, the sweat, and so on. So it is easily transmitted through sexual intercourse and blood transfusion. That's why in the hospital, when patients come or donors come, the first thing is to screen for hepatitis B. And then one thing I want to make our listener to understand is that unlike other viruses that does not withstand adverse conditions for long, the hepatitis B virus actually resists adverse conditions for long. It means that out of the body of the host, the virus can stay for even as more than 5 days. So this is like saying that even eating utensil, if the virus is found in the saliva, even eating utensil with somebody that is infected with the virus eat and then deposit the spoon, after 2 to 3 days, another person pick the spoon, you are still at risk of contracting the virus. So it is commonly spread, but through sexual intercourse. So people that practice unsafe sex with those who don't actually know their status as far as hepatitis B is concerned are putting themselves at risk. Then common means of transmission too is body contact, direct body contact. When somebody sweat and you come in direct contact with that person, especially when you have open wounds, you have the risk of contracting the virus. And then mother too, transmitting the virus to their children during birth. That one is also very common. So the children that are born from hepatitis B, parents are at risk of contracting the virus.
And now, how can I know, or how can we know that we are suffering from hepatitis B?
Yes, from the signs and symptoms, but mostly people don't actually consider the sign and symptom as a need for medical checkup. People that have hepatitis B, the first thing is that they usually have on and off fever, they have nausea and vomiting, they have loss of appetite, they don't have appetite for food, and then general body weakness, fatigue. They feel like their body is not their body. That is the early phase of the infection, which is known as the acute phase. But when the infection is chronic, everybody will know that you're suffering from hepatitis B, because you have there will be yellowish coloration of the eye, what we call jaundice. Then the person will be passing out dark urine, sometimes just yellow urine. And then at that moment, you see most patients are complaining of upper abdominal pain. That is where the liver is positioned, because at the chronic stage, the liver is already involved. So when the liver is involved, most patients, they always have that on and off pain, upper abdominal quadrant pain, the right upper abdominal quadrant pain, where the liver is located. So from the signs and symptoms. But to confirm the diagnosis, patient need to go to the hospital where their blood sample will be collected for tests. We have the quick or the rapid strip test that give the result immediately within a few minutes. You have the result will show if you are positive or you are negative for hepatitis B. And if the result is positive, then we will send the patient for further investigation, like to do the echography, so that we rule out whether the liver is already touched or not.
For those who would like to participate in today's edition of the program, here are the contacts: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Over to you, doctor. What other health problems can hepatitis B cause to the problem, apart from the liver, cause to the body?
Okay, as I said earlier, from the signs and symptoms, you see that people that are suffering from hepatitis B are at risk of other viral infections. We have hepatitis D that only infect the people that are suffering from hepatitis B. It means that there's a correlationship between hepatitis D and hepatitis B. So if you are not suffering from hepatitis B, you can't catch the hepatitis D virus. So once you are suffering from hepatitis B, know that you are at risk of hepatitis D infection. And if the
you have a caller online, we'll come back to you, doctor. Hello.
Okay.
Hello, good day.
Good day, sir. Your name, where you're calling from, and your question, sir.
My name is Francis, and I'm calling from there.
Okay, please, can you increase your volume?
My concern is at the level of, let's say, depistage, because the question dealt with a traditional doctor. So how does he make the diagnosis of hepatitis B? Because he's talking that he's diagnosed. So how does he do the diagnosis of hepatitis B? Thank you.
Thank you for your question.
You
made mention of the
exactly.
answer
He's
already.
equally a medical doctor. He's not just a Tradi
We
practitioner.
have another caller on the line. Hello.
Hello?
Yes, hello.
Yes, you say when somebody is having that problem, the person who, when the person urinate, you see the person urinate will be yellow. It means anybody that urinate yellow, it means the person have the
Not automatically. That's why you made mention of the diagnosis, right?
That is it.
Exactly.
Those are just the common signs and symptoms that can make you to feel like you need to go to the hospital for medical confirmation.
Only the hospital can diagnose this.
Yes, can give you
And
the medical confirmation. Yeah.
Exactly.
Thank you.
Now, we'll come back to this. We're talking about other health problems that hepatitis B can cause to the body.
Yes, okay, like before we had the call. So what I was saying is that when you have hepatitis D infection, which comes as a result of a previous infection with hepatitis B, the patient is suffering from what we call super infection. And that infection is not easy for most patients. They will risk liver cirrhosis and even liver cancer or liver failure. So one thing we have to understand with hepatitis B is that once the virus reaches the extent where the liver is already touched, the whole body is sick, because the liver is that vital organ that helps the body to detoxify the body, to remove toxins from the body. All the medications that we take is metabolized at the level of the liver. So once the liver is already sick, it means that the whole body is sick. That is the reason why we think that this information should be passed to the public, so that people are aware that this is a condition that when you are already a victim, you risk a lot of problems, because the liver is one of the vital organs of the body, and if there's a liver failure or if there's anything that is compromising the liver, it means that the entire body is sick. So there are a lot of complications. Just understanding that the sick liver is already a big problem.
We have another call on the line. We'll come back to you.
Hello?
Hello.
Yes, hello, madam. Good afternoon.
Good afternoon.
Your name, where you're calling from, and your question.
Yes, I'm Tikla from Yaoundé.
Okay.
Your question, thank you.
Yes, I would like to know, is it possible for someone who has a hepatitis B to be in contact with someone, but the person doesn't contact the sickness?
Okay. You got the question?
I got the question very well.
Okay.
Okay, madam, thank you for the question. Yes, we have had cases like this. We have partners like husband and wife one of the partner is positive and the other is negative. The one thing you have to understand with hepatitis B virus is that is the reason why we have the vaccine. So once a person is vaccinated against the virus and the vaccine is actually active in the system, you don't risk contracting the virus. And then secondly, some people have that natural immunity of withstanding viral infection. What makes any viral infection to manifest in the body is the weak immunity. So those who have strong immunity can come in contact with the virus and they don't develop the infection. So it is common, madam.
And is this condition very common in Cameroon?
Not quite very common in Cameroon, but I've seen cases. I've seen some few cases where sexual partners, one is positive and the other is negative. But a lot is still supposed to be looked into consideration because, like I said earlier, it can be that the other sexual partner is having a strong immunity or had previously been vaccinated for the virus. So you will see that there are two sexual partners and then one is positive and the other person is negative. Yes, I've seen cases like that in Cameroon.
So what is the prevalence rate approximately? How many patients can we say we receive in our hospitals in Cameroon sick of this disease?
Okay, a general view about the prevalence of hepatitis B in Cameroon. Cameroon is one of the country worldwide that is having the highest rate of hepatitis B infection.
Wow.
Because worldwide, the recent publication of the statistics about hepatitis B, the World Health Organization has documented 250 million cases. Out of the 250 million cases, Cameroon started at 11.2%. It means that we are really at the peak. So if you want to count the countries that are having the highest rate of hepatitis B infection, Cameroon will be one of the...
We have another call on the line.
We have another call on the line. Hello?
Hello.
Yes, sir. Good afternoon.
Good afternoon, madam.
Your name, where you're calling from, and your question.
My name is Etienne. I'm calling from Buda.
Okay, go ahead.
My problem is that I want to ask if we can...
I didn't get you, please.
Wait, can we treat the opportunity in Hepatitis B?
Okay, for
Okay,
sure.
thank
We'll
you
come
for your
into that
question.
in the course of the program. But
Si vous me donnez le contact du docteur.
Appelez
noted.
après le programme. s'il vous
Après
plaît.
l'émission, vous allez l'appeler pour avoir le contact.
Just be following up with the program. You will reach where we'll talk about the treatment option.
Exactly. Okay. You were talking about prevalence rate,
Yeah,
Lucy,
we're talking
and
about
he was
it. We have another call on the line. Hello.
Hello.
Good afternoon. Good afternoon, sir. Your name, where you're calling from, and your question.
I'm Prince. I'm calling from Yaoundé.
Okay, go ahead.
Yes. The doctor mentioned of the symptoms of the hepatitis B, and I've been having same symptoms like that urine color, then the body weakness, etc. And then I've done the test and it's negative. So I wanted to ask the doctor, what could be, which test can I do again? Like,
Okay, thank you.
You got a question?
I got the question very
Okay,
well.
you can help him.
Okay, thank you, sir. What I would advise you to do, because the signs and symptoms that we are giving is not just peculiar for hepatitis
We
B.
have another call on the line. Hello.
Okay, we'll get back to you.
We lost the
We
caller.
lost that caller. Okay. You can
Okay, yes, like I was saying, it is not peculiar for hepatitis B. When we talk about fever can be, maybe you have malaria or typhoid, you can still have those signs and symptoms. Yeah, so
exactly.
what I would advise you to do is to, if you have done the test for hepatitis B and it's negative, you go back to the hospital and you do the general screening. Let us also think that maybe you are suffering from other conditions and not necessarily the hepatitis B. So you will need to see a medical practitioner from the different signs and symptoms. Other lab investigation can be made, and then what is actually troubling you rule out.
A caller also made mention of. We have another caller on the line. Hello.
yeah, hello, madam.
Yes, sir. Good afternoon. Your name, where you're calling from, and your question.
I'm Sayan calling from Buffet.
Okay, go ahead.
Madam, is it true that somebody come in contact with somebody that is having hepatitis B, like with the state of somebody that is having hepatitis B, is it possible that the person can also be affected with the illness?
Okay, he's talking about the question the doctor already answered. That is, so if you have hepatitis B and maybe your partner has or somebody close to you, is it going to be transmitted to you? He's talking about being contaminated, if I can say so.
Yes, I think
Doctor, could you answer that
Yes,
question?
answer the
I think his question is focused on sweat. You contact with somebody that is sweating, and then the person is hepatitis B. But one thing you have to understand here is that, like we say, even you can come in contact with the blood of somebody that is suffering from hepatitis B and you don't get the virus. But if you have a cord or it enter in any of your body orifices, then you can get the infection.
When it comes to sweat?
When it comes to sweat, if you don't have a wound on your body, it is still a difficult situation. Rare cases can be documented as transmitted through that means.
And now, since we don't have enough time, let's dive into the treatment options. How can someone manage this condition, this health condition?
Yes, one thing we have to understand is that the treatment protocol for hepatitis B is divided.
We have another call on the line. Hello.
Good afternoon, madam.
Good afternoon, madam. Your name, where you're calling from, and your question.
Madam Antoinette.
Okay.
Calling from Siku.
Go ahead.
Yes, if a pregnant woman she went for antenatal and she did some tests and the result shows that she's having hepatitis. Then she went to a practitioner and the doctor asked her to go and do some tests, and they ran the tests on her, and it shows that the hepatitis is dormant. So how is she going to do to prevent her baby from getting the hepatitis?
Okay.
Thank you.
Thank you so much.
Okay, madam, thank you for your question. Even if the virus is dormant, once you are diagnosed positive for hepatitis B, before the woman delivers, there is a vaccine that we give to the child 24 hours. Yes, we have to give the hepatitis B immune globulin. That one is administered to the child immediately the woman delivers. So that one will protect the child from infection with hepatitis B virus. So whether it is dormant or not, make sure that before you go to deliver, you have your hepatitis B immune globulin that will be administered to the child immediately you deliver.
Treatment options, that really, doctor.
Wow.
Okay, for the treatment option, first is from the diagnosis. You need to be diagnosed first. Once you are diagnosed, we are not thinking about the treatment. Now, the first thing about the treatment, especially for new cases, is that I said earlier that when you come in contact with the hepatitis B virus, if you have a strong immunity, your immune system can naturally fight the infection. So, but once the virus starts manifesting or multiplying in your system and it is diagnosed earlier, the first thing that we give to the patient is something that will help to boost the immunity. We have the interferon. There are two types that are common. We have the interferon alpha 2A and we have the interferon alpha apt 2B. That one actually just go to boost your immunity, to help your immunity to be able to fight off the infection. But for those with weak immunity, we can also give something to also fight the virus. It is true that it will not completely clean the virus from the system, but it will reduce the viral load. We have medication to like Tinovir. We have medication like Enterocavir that actually the patient take it for life, just like the antiretroviral treatment. Yeah, the patient will actually take it for life and it will check the virus so that the virus doesn't spread. Then one thing I want to make our listener to understand is that once you are diagnosed with hepatitis B, the first treatment option is change of lifestyle. Patient need to change their lifestyle. If you are somebody that is taking alcohol, you need to cease from drinking alcohol. Then don't take roadside medication. All your medications are supposed to be prescribed. And each time you go to the hospital, even for any other health condition, make sure that you inform your doctor about your situation of hepatitis B. Because there are certain medications that we don't give to patients that are having hepatitis B. Don't go picking paracetamol from road and drinking and so on. Those things, they go to make your condition to become worse. Then patients that are diagnosed with hepatitis B should understand that the target of this virus is the liver, and then you have to do everything possible to protect the liver. So you need to be doing regular exercise. Then you stay away from eating cholesterol food. Cholesterol food are not actually very good for the liver. And then, like I said earlier, don't take medications that are not prescribed. Then we also have some natural spices that are very good, especially for those who are suffering from hepatitis B. We have ginger, we have garlic, and then we have turmeric. Those spices, they have been proven scientifically to be very, very excellent to reduce the viral load and to protect the liver too.
Okay.
So
All right, doctor. Due to time, we will not be able to have more details. But for those who have their questions and like the a caller
We're
asked,
asking for the
the
number.
number of the doctor, you can call after this program via the same number to have the contact of the doctor. Meantime, thank you very much, doctor, for your presence today.
The pleasure is all mine. Thank you so much.
Thank you very much, Immaculate Fogwe.
The pleasure shared.
For presentation, I have been Esia Lucy Liengu. Ladies and gentlemen, we have come to the end of this program, of your program you and heard on Quinoxe Radio Multimedia. And at the technical dashboard, we had Jonathan Babiola and Bertrand Bonsny. Thank you very much, and stay in the company of more interesting programs on Quinoxe Radio and television.